you feeling sad, irritable, constipated, lethargic, extremely fatigued, or sensitive to the cold? Do you suffer from pale skin, hair loss, unintentional weight gain, or brittle nails? You may have a condition called hypothyroidism. Millions of Americans suffer from hypothyroidism. Genetic factors account for approximately 80% of the risk for hypothyroidism, leaving a role for environmental factors such as diet in many cases. You're at an increased risk if you're age 60 and older, female, or have a family history of hypothyroidism. Individuals and populations ingesting inadequate amounts of iodine appear to be particularly at risk, as do patients with celiac disease. Signs and symptoms of hypothyroidism can include sodium and water retention, swelling in the extremities, low levels of calcium in the blood, and low levels of potassium in the blood. Synthroid is one of the preferred medications to treat hypothyroidism. The active ingredient in Synthroid is levothyroxine sodium. It replaces or provides more thyroid hormone, which is normally produced by the thyroid gland. Low thyroid hormone levels can occur naturally or when the thyroid is injured by radiation, medications, or removed by surgery. Having enough thyroid hormone is important for maintaining normal mental and physical activity. Usually, thyroid replacement medication should be taken for life. It could take several weeks for your symptoms to improve. Use Synthroid only as prescribed by your doctor. Do not stop taking or change the dosage of Synthroid you take, or how often you take it, unless prescribed by your doctor. Some drugs or supplements can interact with Synthroid, making it less effective if taken at the same time, so it's best to take Synthroid 4 hours before or after. Some examples include iron products, calcium supplements, or antacids. Take Synthroid as a single dose, preferably on an empty stomach, 30 minutes to 1 hour before breakfast. Synthroid absorption is enhanced on an empty stomach. Some foods may cause your body to absorb less Synthroid, such as walnuts, high-fiber foods, and soy. Your dose of Synthroid may need to be adjusted if you consume these foods. Store Synthroid away from heat, moisture, and light, and keep out of the reach of children. Do not take Synthroid if you are allergic to any of its ingredients. Tell your healthcare provider if you are taking other prescription medications or over-the-counter products, and if you develop an allergic reaction. Tell your healthcare provider if you begin or stop taking other medications while taking Synthroid. Thyroid hormones, including Synthroid, should not be used to treat obesity or weight loss in combination with other medications. Patients with normal thyroid levels should not take doses of Synthroid within the typical range used for hormone replacement because they will not be effective for weight loss. Larger doses may cause serious or even life-threatening events, especially when used together with specific drugs used to decrease appetite. Long-term use of Synthroid can cause bone loss in older females, which can lead to early onset of osteoporosis. Side effects of over-replacement can include rapid or irregular heartbeat, chest pain or shortness of breath, muscle weakness, nervousness, irritability, sleeplessness, tremors, change in appetite, weight loss, vomiting, frequent bowel movements, excessive sweating, heat intolerance, fever, impaired fertility, decreased bone density, changes in menstrual periods, and other unusual medical events. Instruct patient to take medication as directed at the same time each day. Take missed doses as soon as remembered unless it is almost time for the next dose. If 2 or 3 doses are missed, notify the healthcare professional. Do not discontinue without consulting the healthcare professional. Advise the patient to report any unusual signs or symptoms. Emphasize the importance of taking a thyroid function test each year to monitor the drug's effectiveness. Ask your healthcare professional if Synthroid is right for you.